Connection, check connection, good. All right, hello everybody. It's Dr. Alex Earl, and we're here at Pure Plastic Surgery, and it's Hump Day with Dr. Alex Earl. This is, of course, the time that I get to spend with you guys going over plastic surgery topics and, of course, answering all of your urine and burden questions. All right, so we haven't done this in a while, so today I wanted to take some time and talk about the cell saver. That's right, so we're going to be doing a little bit of a show and tell here today. I'm going to kind of go over the cell saver, what it is, how we set it up, what it does, etc. And then, of course, towards the end, I'll be happy to take any of your questions regarding the cell saver or anything related to plastic surgery from head to toe. Okay, so what we have here is the actual machine. So this is the cell saver. I'm not sure we can see all the way down here, but it's called the Cell Saver Elite. So we have the Elite Cell Saver machine here. It's made by a company called Haemonetics. Okay. And what do we use the Cell Saver for? So we use it typically for the large lipo cases. So that's going to be your lipo 360, okay, 360 plus, and your BBL or South Beach butt lift as well. So any sort of BBL or lipo 360 type of case, all right? And so what's the use of the cell saver? What does it do? So the cell saver, so when you do liposuction, right, as many of you know, when we remove the fluid from the body through the liposuction cannula, it goes into a container, and that container starts to separate out. So the fat separates from the rest of the fluid. And I'm sure some of you have been following me for a while, so I'm going to ask the question, what tends to settle out on top? What goes on top, the fat or the fluid? Does anybody know?
Let's give them a minute.
Yeah?
Yeah. Okay.
Any answers there? Fat or fluid?
Okay, I have one on TikTok.
Yes.
Fluid.
Fluid on top?
Yes, sir.
No. So actually the fluid ends up in the bottom, okay? And the fat floats on top. All right? Because fat is actually less dense than fluid, than water. Okay? So the fluid ends up in the bottom, the fat ends up at top. You got to let it sit for quite a few minutes, probably about 10 minutes or so. But then you want to then remove the fluid, because when we're injecting the fat back, like for example, we're doing a BBL, you want to get, you want to inject as much of the purified fat as possible. So you want to remove all this excess fluid. But within this fluid, there's going to be two major components, okay? There's going to be the tumescent solution, which is a solution that we instill before doing the liposuction, which is mostly what we call a sodium chloride kind of IV fluid type of solution. And then, of course, there's going to be blood, right? There's going to be a certain amount of blood within that fluid. And so what the cell saver does is that we can remove this fluid, pass it through the cell saver. The cell saver has multiple filters. It filters out essentially everything but the blood, okay? So that now, then you pass it through the cell saver, okay? And then you're left with just the blood. And then you can give that back to the patient, okay? Kind of like an auto transfusion. And that's kind of the way it works. And so at the end of the case, we can give some of that blood back to the patient. There's overall less blood loss for the case. The patients feel better because their hemo levels are higher and they recover quicker, okay? And that's really the whole point of using the cell saver for large volume or larger volume liposuction. Okay, by large volume liposuction, I mean up to 4 liters. As you all know, that is the max that we can do here in Florida when you're talking about office-based surgery, which is what we have here at Pure. So when you do office-based surgery, you're doing lipo or BBL, the most fat that you can remove is 4 liters of supernatant fat, which means not the total volume, only the fat volume. So 4 liters of the fat volume is another good reason why we have to remove the fluid, so that we can then count that volume of fat accurately, okay? Because if we're counting it all, then it's not all fat, and then you're not being accurate, you're not removing as much fat as you could otherwise, all right? So for example, this whole thing is 1 liter, right? And I remove half of it, 500 cc's of that fluid, which is that IV fluid plus the blood, then I'm only left with 500 cc's of fat, which means I have another 3,500 cc's to go, okay? Hope that makes sense. All right. But what we don't want to do is just throw that blood away, right? We don't want to just throw that blood away and not give it back to the patient, and that's where the cell saver comes in. All right, so how does it work? Yes, it's a fairly large machine that you can see here. This was actually originally intended for large cardiac cases, all right, for like your open heart cases. That's the original indication for this machine, and of course we've now adapted it to plastic surgery for the big liposuction cases. So the machine is something that we can roll from room to room, okay, the machine itself, but it comes with several kind of packages which are, of course, sterile. This all has to be completely sterile because we're giving it back to the patient through the IV. And so it's all single-use sterile packaging, meaning one package per patient. That way things will never get mixed up, right? It's impossible to give someone else's blood to another patient. It's single-use, one package per patient, single-use sterile, okay? So I'm not going to open it here, but this is like the first pack here. This is the part that goes inside here. There's a filter inside here. If you open this up, there's a filter that goes inside this little hole here. That's kind of like a centrifuge and a filter, and that's what this pack is. Okay, that's actually the main filter, but it's your second filter, because before that we placed this one here. I'm not sure if you can see that, but it's kind of looks like a large cylinder, telling you how much volume there is, and there's this black filter inside there, okay? And that's the filter that we kind of place here. And so when we suction the fluid out of that canister, which is also a sterile canister, by the way, into this sterile canister, it passes through the first filter. So this is filter number 1, okay? And in order to pass it from one canister to the other, we use a special, once again, sterile single-use tubing, okay? So you use the tubing, you pass it from the sterile canister out here to the sterile filter number 1, and from there it goes into sterile filter number 2, all right? So already double filtration. And what these filters are doing is they're separating everything else from the blood, right? So they're keeping the blood, and everything else goes away. It becomes waste, right? So the tumescent solution, any potential fat particles that may be in there, any like potential like scar tissue, fibrous tissue, anything else really, anything that's not blood gets filtered out, okay? And there's a bag, there's kind of like a waste bag that goes in here, which is not there right now, but it's also sterile. But that waste bag then eventually gets thrown out, and that's what we throw out, okay? So once we do all that, it filters everything in the blood, and then it pumps the blood up into a bag that looks like kind of like a saline bag, okay? But we fill it up with that now centrifuge and purified blood, and then we can give that back to the patient. You can think of it like an auto transfusion. We're basically giving the blood back to the patient, okay? But before we do that, and there's the last piece that I want to show you here in this little show and tell, before we do that, we connect this little filter to the IV tubing. So this is now your third filter. And this is kind of your third and final filter before the blood actually gets into the patient's vein. Okay? So that's the way it works. Large machine, multiple filters, so that we're giving back basically purified blood without any contaminants or anything that's going to cause an issue. Okay? So we use it for the big lipo cases. We use it here at Pure Plastic Surgery for all our patients. All our patients that are getting lipo 360, BBL, or South Beach butt lift, they all get the cell saver, every single one. All right. Now, if you want to have more kind of like criteria, there are some places where they might say anyone who has a hemoglobin level 12 or above, they don't necessarily need it unless something happens during the case where it becomes more bloody. But certainly anyone who has a hemoglobin between 11 and 12, okay? And let's write that down here. So if your hemoglobin level is between 11 and 12, then 100% you need the cell saver. 100% you need the cell saver, all right? If your hemoglobin level is less than 11, no surgery. Okay, that's our cutoff, that's our limit. So if your hemo level is less than 11, there's no lipo 360 or BBL surgery that will be done because you're starting off at a very low hemo level already. all right, and the chances of you needing a transfusion, even with the cell saver, are too high. Okay? So less than 11, no surgery. Between 11 and 12, you definitely need to cell saver 100%. But here at Pure, we just give it to everyone because I think overall it makes the recovery better. There's less anemia, less blood loss overall, and the patients recover faster. Okay? Now, the next question that we get is, well, how much of that blood are you actually getting back? So it's not going to be all of it, all right? Unfortunately, there's no machine that can give you like 100% of that blood back. It does a pretty good job, but it's not going to be 100%. It's kind of more in that kind of like that 50% range. That's why we say that if your hemoglobin level is less than 11, then it's best not to have surgery because you're starting at a low level that even with the cell saver, the risks of having to go to the hospital or needing a blood transfusion are still too high. Okay, so I hope that makes sense. But say you start off with a chemo level of, say you're pretty good, you start off with a chemo level of 14, right? We do the surgery, we're going to drop that chemo level. We typically, it's not unusual to drop it about 4 points. We may drop it to a chemo level of 10 with a relatively large liposuction case, like 4 liters of removal of fat removal, supernatant fat removal. All right, then we give you the cell saver, okay, and we are usually able to get it back up to about 12. Okay, can you all see that? I know this marker is not doing great. Can you see it over there? So you get to about 12. Okay, so you start with 14. We're going to drop you to about 10. You get the cell saver. You're going to be at about 12, and that's going to make you feel better. Okay. All right, so that's kind of how that part of it works. So typically then the next question is, I'm just going to anticipate this question because we get it a lot, is, well, therefore, doc, if you're doing the cell saver and you're doing it for all your patients, then there's a 100% chance that I will never need a blood transfusion. And the answer is, of course, no, right? Like you guys know, you've been following me for a while, I always say in medicine, nothing is 0% or 100%. Okay, so are there patients where we've used the cell saver and they needed a blood transfusion? The answer is yes. But fortunately, because we use the cell saver for all our patients, it's very, very few patients. And I'll tell you how few right now with real numbers. I do approximately 600 bbls per year. Okay? I use a cell saver. So the cell saver is used in 100% of these cases. So that means 600 cell savers are being done. And I typically get, depending on the year, somewhere between 1 to 4 patients total that may require a blood transfusion. Okay? So do the math, okay? It's much less than 1%. Okay? Right? 1 over 100 would be 1%, 1 over 600 is less than 1%. All right? So less than 1%. All right? Which is actually very, very good. And that's why we do that for all our patients. Okay. Questions?
Well, this is about the cell saver, and I keep it the first. Does it hurt?
Yeah, so the cell saver actually doesn't add any pain to the procedure at all because really, the parts that are quote-unquote painful, which is your liposuction, that's being done anyway, right? So all of this happens kind of external to the patient. So once we do the liposuction and all of that, everything that we kind of remove via liposuction goes into that sterile canister. Then we allow that to separate out, and then we suction the fluid from the canister, which, as we said, is going to be towards the bottom of the canister there. And then when we transfuse it back into the patient, it's like a regular blood transfusion. So it's not going to be causing any pain like if you get blood transfusion for any other reason.
Do we need likes here at TikTok for this?
Yeah. All right. We definitely love the likes. So if you guys are watching and you're learning something new here, please send us those likes, and a little dinosaur would be awesome too.
Is it possible for the skin to be bumpy after a lipo 360? If so, how long does it last?
Yeah, so the skin can be bumpy for several reasons, but the most common reason is typically areas of inflammation, okay? And if it's early in the process, meaning it's certainly within the first 3 months or so, then a lot of times this can be fixed in in a non kind of invasive way, meaning it can be fixed through compression, massage. Sometimes you require some additional treatments like wood therapy or cavitation or like radiofrequency type energy as well. Okay, so how long will it last? If it's because of inflammation and these things, it can easily last about 3 months or so, but eventually it'll start to soften up and get better. Okay, fibrosis as well. If you catch fibrosis early on, you can treat it non-invasively with these modalities. Okay, now the issue becomes if, say, the fibrosis is not treated appropriately or it's ignored or anything like that, and it's been now a year since your liposuction case, then it's going to be unlikely that those areas will go away. And a lot of times then you need to come back to surgery for a repeat liposuction case where we're trying to smooth out the areas and remove the areas of fibrosis as best as we can.
Okay, do you offer vaser with BBLs?
So I don't use the vaser, and let's explain that for our folks here. So what is the vaser? And it is a vaser with a V, okay?
Yeah.
So
Vaser,
right? So the vaser is actually a device that you do in conjunction with the liposuction, and it uses ultrasound energy, okay? So ultrasound energy, which is you can dial it up or down, but it basically heats up the tissues and can potentially even liquefy the fat, okay? Depending on how high you dial it up. Me personally, I've never been comfortable with using the vaser because I do a lot of fat transfer, and even though the company says that at certain settings the fat will still survive, it's just logically to me doesn't make sense that you're imparting energy on these poor little fat cells, and you're heating up these poor little fat cells, and then we're expected to transfer them and have them survive, right? So that's really the main reason why I don't use the vaser. Now I know there are a lot of people out there that use it because it helps, or at least they feel that it helps with skin retraction, okay? And so what I do then, when I have a patient that requires some additional help with skin retraction, is that I'll do the liposuction first. I'll harvest those healthy fat cells, and then once we're done with that portion of the procedure, we'll go and use the BodyTite to then help with the skin retraction, okay? And so that way, I've already harvested the fat's already in that other canister that we're then going to use to then separate it out and then transfer to the patient. So I'm happy where the fat is healthy, and then we go back and then we address the skin with the BodyTite.
Can you do breast reduction with leaf fat transfer to breast if someone doesn't want implants?
So the technical answer, that can it be done? Yes, it can be done. I personally, I don't like to do fat transfer to the breast because, well, there's a few reasons really. When you do fat transfer to the breast, you can only really get a modest change in terms of volume. You're not going to get a drastic change. Typically, the most you can inject per breast and have it survive is somewhere between 100 and 200 cc's of fat. Otherwise, the fat tends not to survive, and it has a high tendency to become fat necrosis, okay, where the fat dies and becomes scar tissue. So it doesn't really you can't really change the volume too much. You can't alter the shape at all. All right, it doesn't really help with changing the shape. So it's going to be the same shaped breast with just a little bit more volume, okay? And so for those reasons, I don't really like to do fat transfer. I much rather prefer to place an implant. I have a lot more control of the final shape of the breast. I can change the volume much more willingly, and I can potentially change the shape of the breast and make it a more, a rounder, more aesthetically pleasing breast much easier with an implant as well.
I had a kidney transplant 2020. Can I get lipo 360 and a BBL?
So that's going to be very much taken on a case-by-case basis, and it depends really on what medications you're on right now, okay? Kidney is one of the transplants where eventually some patients don't really need a lot of immunosuppressive medications to keep it going, which is great, and it's great for the patient. So it depends really on what type of immunosuppressive drugs you're on, because if you are on, steroids or any sort of other immunosuppressive medications, then we should not do the surgery because your chances of infection will go way, way high, and also chances of poor wound healing.
Approximately long is the BBL procedure from start to finish?
That's a great question. So that's going to depend also on the patient, well, and the surgeon, right? I can tell you when I first started doing this well, let's not say many years ago. I'm
A few.
aging myself there. But quite a few years ago, I would say it would take me at least, it would routinely take me 3 to 3.5 hours, okay? And that's not the case today. Of course, I've done thousands of these procedures now, about 3,000 BBLs, over 2,000 BBLs with the use of ultrasound guidance. And so obviously I've become also a lot more efficient and a lot more comfortable with the procedure over the years. So if I have your I would say your standard South Beach butt lift, which tends to be a patient that's in the lower BMI range, say a BMI somewhere between 22 and 23, and it's a straightforward South Beach butt lift, meaning we're not adding any other areas on. We're just doing the lipo 316, the fat transfer. That sometimes I can do in an hour and a half, 1.5 hours, okay? Now say you have more of your typical BBL patient, a little bit higher BMI is now 8 instead of 23, okay? Then that may be about 2 hours, okay? And then of course if you have now say a little bit, BMI 28, and you're also adding say body type to the abdomen and body type to the arms, and you have all these other things that are also going on, then yeah, it could potentially be anywhere between like 2.5 to 3 hours. I typically limit all my surgeries, not just BBL, but anything that I do in the operating room, I don't like to do it any longer than much more than 3 to 3.5 hours tops. That's really the most that I like to have any patient under general anesthesia here in my office-based surgery setting.
Okay, Doug. Can I have a tummy tuck if I have fibrosis or a BBL?
So the
Fibroids. I'm sorry. Can I have a tummy tuck if I have fibroids or a BBL?
So I'll separate it out. If you have fibroids, you can certainly have a tummy tuck. The fibroids are basically part of the muscular wall of the uterus, okay? The uterus is deep it's within the abdominal cavity, and a tummy tuck is always superficial to that. So we're nowhere near the uterus when we do a tummy tuck. So can you have a tummy tuck if you have fibroids? The answer is yes. Now here's the one thing you have to be aware of. If you have very large fibroids, and there's some women that do, sometimes those fibroids are so large that you can see them kind of poking out the lower belly there, right? And remember, since the tummy tuck is not going to address that issue at all, we can remove the excess skin, we can get things as tight as we can, but if that fibroid is pushing out, you're going to see it after your tummy tuck as well. So if you have a large fibroid, I would recommend seeing your GYN doctor first to see what their recommendation is. They may recommend to have it removed, and then you can do that first and then your tummy tuck, and you're going to have a much better tummy tuck result. Okay? Now, if you had prior BBL, can you do a tummy tuck? Yeah, definitely. You can definitely do that. Again, we want to assess each patient to make sure they're a good candidate. Where it becomes really tricky though, this is important. If you already had like 2 or 3 rounds of liposuction, doing the tummy tuck after that becomes very, very challenging. You have to be very careful. If you have a lot of scar tissue, a lot of fibrosis, you've done 2 or 3 rounds, perhaps you've used something like a vaser or a laser or something like that before, you have to be very, very careful, because when you do that tummy tuck, you may not have the best blood supply to the skin, and may end up with areas of skin necrosis. So you have to be very careful with that. All right, but I would say that for most patients that only had their 1 round, their one round of lipo or their 1 round of BBL, they're typically okay to have that tummy tuck after. But it's not my primary recommendation, okay guys? You all know that I typically recommend that if you have any degree of skin laxity or muscle weakness or muscle separation, that you should do your tummy tuck first and then come back 3 to 4 months later to have your lipo 360 or BBL.
Okay, that was the other question I have, so you already answered that, Doug.
Right.
Okay, it is okay to sit on an avocado float or a zero gravity chair with a hole cut out for bottom, like a donut, I guess.
Yeah. So it is acceptable. So the answer is yes, that is acceptable. We typically ask our patients that they kind of lay on their belly, but we do understand that there are certain patients, and I gotta admit, probably myself, I don't know if I'll ever have a BBL, but if I do, I know I'm not gonna be able to lay on my belly for 6 weeks. It's gonna be tough, and there are patients out there where they find it really, really hard to sleep on their belly, lay on their belly. And therefore, the next best option is to have something like a zero gravity chair or the avocado or a mattress with a cutout, where the whole point is to try to relieve or minimize the pressure to the buttock and hips, especially during the first 6 weeks, so we can get as much of that fat to survive as possible.
Okay, Doug. We have plenty. Okay. When do the hard lumps after lipo go away with massages and compression?
Right, so if the lumps are mostly due to inflammation or perhaps an early fibrosis that we're recognizing early and treating, they do tend to start to get better, but it's not going to be anywhere before 3 to 4 months. It can easily be, 6 months or so. And I'm not prepared to kind of quote unquote quit on these areas until it's been a year, so 12 months since surgery.
Okay. Doctor, how many massages do you recommend done after a 360 lipo BBL?
So I'm recommending now a minimum of 20 massages, okay? 20 massages. So you want to do at least 20, okay? And this is very, very important. I would say, again, a few years ago when I started recommending, my initial recommendation was 10. I found over the years and experience and thousands of cases that 10 is actually not enough. So I do recommend a minimum of 20, but that doesn't mean that that's all you'll need. There are some patients that may need more. So there are patients that may need 30, for example, okay? And how do we break them up? So say, rather than, just so it's easier, rather than 20, we say 21 massages. So the first 7 are gonna be daily. The next 7 are gonna be about every other day or 3 times a week. So let's say 3 times per week, okay? And then the last 7 are gonna be weekly, okay? So you're gonna start off with daily massages, then you're gonna spread them out a little bit to about every other day or 3 times a week. And then your last 7 are gonna be weekly, and that's gonna be your weekly maintenance massage there.
Okay. Can tummy tuck scar revision be done under local, anesthesia?
Yeah, well, it depends on the extent of it, okay? Typically, if you're doing the entire tummy tuck scar, that's a lot. It's very, very long. Remember, you can only give a patient so much lidocaine, which is what we use for local anesthesia. You can only give the patient so much lidocaine before it becomes toxic, okay, or you reach what we call levels of toxicity, okay? And therefore, if it's the entire incision, sometimes we may need to do another type of anesthesia like MAC or general anesthesia. Now, if it's your very typical kind of little dog ears that you have at the ends, okay, sometimes that can happen. Most of the time, we can do those under just local anesthesia. Or if it's a small area, a small segment, we can do that under local.
Okay, for all those that are asking for consultations, virtual consultations, I have like a dozen of those.
All right. Oh, yeah. Excellent.
Where do we go?
Where do we go? All right. So, the easiest way, I'm going to tell you what the easiest way is. Okay, this is the easiest way to start. The easiest way to start. Okay, you go to the website, which is www.pureplasticsurgery.com. Okay, you go to the website, and there on the landing page, pretty much the first page, you're going to see a button that says virtual consult. Okay, you're going to hit on that button. That's going to take you to a page where there's going to be a questionnaire with several questions that need to be answered, and where you're going to upload photos. Okay, now the questionnaire is very, very important. You need to answer every single question, even if you're not exactly sure what the answer is. It doesn't matter. Just put something on there. All right, just fill it out. Don't leave anything blank. And then you're going to upload 3 photos. Okay, typically a front view and 2 side views for most cases, but if you're doing a BBL, 4 photos: front view, 2 side views, and back view. Okay, and that's what you want to do once you get there. Now, I know there's already people saying, well, what if I don't want to do a virtual consultation? I want to come in person, or want to do a video call. That's okay. Don't worry about it. This is the best way to get started because that's how your information gets to our coordinators, all right, our patient care coordinators. So they're going to receive that information. Oh, the other common thing is, what if I want to do more than one procedure? That's okay too. Just put the first procedure there that comes to mind. It doesn't matter. All right? Your information then is going to get to our patient care coordinator. That way they're going to have your name, your phone number, all, your email, all the ways that they can reach you. And they're going to reach you and you're going to have a conversation with them. Okay? It's a fluid conversation. At that point in time, is you can explain everything you need to talk about. You can explain the different procedures that you want, the fact that, well, whether you want a video call or in-person consultation, etc., etc. And they're going to assist you. You can think of them as your personal concierge, right? But the personal concierge needs to know how to reach out to you. And that's why this is so important. Why this is the easiest way to do it. So in order for your personal concierge to know your information, to have your name, your phone number, your email, fill out this form. Okay, the coordinator is going to reach out to you, and then they'll guide you through whatever it is that you need. So if you need more than one procedure, don't worry, they'll take care of that. If you're interested in on what you wrote down, they'll take care of that, of course. If you're interested in the video call, they'll take care of that. If you're interested in in-house consultation, once again, they'll take care of that. They'll make your appointment, etc., etc. Okay, so don't worry. Just because we're sending you here doesn't mean that's the only way to get in. Okay? But it's the fastest, most efficient way to get it. Alright? Okay, everybody. Well, I hope this was helpful. I know, we get a lot of questions about the cell saver. Not a lot of people kind of know what it does, why it's there, what do we use it for. A common question that we get is, can I use the cell saver for my breast surgery or for my tummy tuck? It's not needed for those surgeries because those are surgeries where we have open incisions under direct vision, very, very little blood loss for those surgeries. So it's really only needed for those lipo-360s, BBLs, and South Beach butt lift, okay? All right, well, again, I hope this was helpful. If you have any recommendations, suggestions for topics you want me to cover, please let us know. You can write that in the comments or send us a DM, okay? But otherwise, I look forward to seeing you all next week on Hump Day with Dr. Alex Earl. Ciao.